Rachel, thanks. The Pennsylvania Service Department, who manages the state's Medicaid program, has the largest budget in the state. While federal funds are on the line, state lawmakers have their own in-house issues to worry about. Our Pennsylvania State Capitol correspondent, Kara Jeffers, has our story tonight. Good evening, Kara.
Good evening, Mike. The Pennsylvania Human Services reports that just over 3 million Pennsylvanians are enrolled in Medicaid, over 120,000 in our viewing area alone. Pennsylvania is spending more than it makes in revenue as Medicaid costs have been rising. Pennsylvania lawmakers are faced with hard questions. They're pressurized by these federal trends. Tense discussions in Harrisburg.
We can't say no. You know, I really respect what
that's
you're
a good
saying,
question, though.
but we can't say no to people.
Are there any entitlements that should be repealed?
As Pennsylvania's Human Service Department answered questions on their budget this week.
It's a big budget, right? $21 billion budget request, up, $2 billion more than we were just 1 year ago.
Most of Human Service funds go towards Medicaid. Inflation and a more sick Medicaid population put the department in the red last year. Conversations over state policy, though, were complicated by looming federal cuts. If passed, states could see, by rough average, a 15% decrease in federal funding each year for Medicaid.
The particular ways in which the program will be cut would fall on state politicians and policymakers. That's not going to be determined at the federal level.
Republican lawmakers say potential fraud and poor efficiency could justify cuts or denying a spend increase at the state level.
We still have to provide for those needs, though, but we also have to look again at, are we delivering the most efficient products and services that we can within human services?
Democrat lawmakers remain focused on future hard decisions.
These type of cuts would be catastrophic to either our ability to cover our fellow Pennsylvanians or to the taxes of every Pennsylvanian if we were to try and make up the difference, to the tune of billions of dollars.
For a specific cut example, around 800,000 Pennsylvanians are on Medicaid because of Medicaid expansions passed in the mid-2010s. These guys are working, but maybe their workplace doesn't have health insurance. These are the type of things that the state lawmakers might have to decide. Are we going to continue funding this if we lose those funds from the federal level? In Harrisburg, I'm Kara Jeffers, Erie News Now.